Hey guys, welcome back to Care Zone. My name is Grace and today I'll be showing you how to make use of the Patient Information Leaflet that comes with your product pack. The Patient Information Leaflet is a document that is largely ignored by drug users. So a lot of people in my interactions with patients over the years, you just buy their drugs, remove the drugs and discard the Patient Information Leaflet and even the pack of the drug. But today I'll be showing you how you can stop ignoring that important document and start making good use of it in order to get to know your drugs better. So sit back and enjoy. Like I said earlier, my name is Grace and this is Care Zone. If you have not subscribed, please do and turn on your notifications so you don't miss any of my videos. So let's jump right in. The Patient Information Leaflet is an interesting document. Some are small, some are large, like the one I have here. It's so big. Some are legible and some are not very legible. Some are colored, some are descriptive, but the information they contain is very important and it is tailor-made for you, the patient. So it's like a letter from the manufacturer to you. So what do you expect to see in it? First, your leaflet tells you the name of the product, and when I'm talking about the name, I mean the brand name. That is like a legal entity and no other drug or brand shares that name with that drug. The second thing you would see on your patient information leaflet is the name of the active ingredient. What I mean is that substance in the medicine that gives you that expected effect you get from taking the medication. Many times it is a chemical name, and I can see why a lot of people avoid trying to know the names of drugs, because some of these names can be big and a little bit difficult to call. But in one of my videos, I'm going to show you how you can familiarize yourself with the drugs you use regularly, their chemical names, and how this can help you when you go to buy your medications. So the next thing you should expect to see on your patient information leaflet is a part titled indications. That is, what is this drug used for? So in this part, you're going to see what disease conditions it is used to treat. Another aspect you will see is mode of action. Some people also call it pharmacodynamics, and the information you will get from this section is how that drug moves around the body and at what site on the body it works to elicit that expected effect. Another section you should expect to see in the patient information leaflet is contraindications. So if the drug is indicated for certain conditions, it is also contraindicated or should not be used by certain persons. So you can have contraindications for children, for elderly patients, for pregnant women, for lactating or breastfeeding mothers. And you could also have some disease conditions such as kidney impairment or liver impairment or liver disease, and people with such conditions are not even expected to take certain medicines. So if there are any of these contraindications, they will be stated in this section. Another section you expect to see is precautions for use. So what are the things you should avoid when using this medicine? What are the things you should do in order to make the medicine work better? There are precautions you should take and certain things you should avoid when taking your medicines in order to get the best out of your treatment. Another section you should expect to see is pharmacokinetics. That is, how the drug is absorbed, metabolized, and finally excreted from the body. Another section you should expect to see is the one titled side effects or adverse effects. So this section tells you the kind of side effects you should expect when using this medication. But it is important for you to note that the fact that those side effects are listed there does not necessarily mean that you will come down with them. But it is good to know, because the manufacturer during preclinical studies has discovered through tests that those side effects are possible. And also post-marketing research, some patients who have used the medicine have reported these side effects that are listed here, but it does not necessarily have to be you. However, if you're using a medication and you are feeling some side effects, it's important to report them to your doctor or your pharmacist. Another section you should expect to see is dosage. Here you will find out the quantity and the frequency of use of that drug. Another important note of caution here is you might read something from the patient information leaflet showing the exact dosage as stipulated. However, the doctor may not necessarily give you that particular dosage, because dosages are measured according to patients' individual needs and patients' individual weight. For example, the dosage of a drug given to someone with kidney or liver disease may not be exactly the same as one that will be given to other patients of the same age or size. So these are left to the doctor's discretion, and that is the more reason why you should not just read it off the information leaflet and think that a mistake has been made. Another part of the leaflet, which is also important, is the one titled storage. Here you will find out how to store your medicine. Some medicines require refrigeration after opening, some require that you keep them in a dark place, and all of those methods of storage are specified in the leaflet. If you don't store your medicines as prescribed, there are dangers that your medicines may begin to degrade and may not give you the effect you expect. So it is important to store them as prescribed by the manufacturer. Another section you will find in your patient information leaflet is the one that discusses drug interactions. Here you will find various drugs or foods or drinks that react with the drug you are currently using, especially important for people who are using a combination of drugs. Certain drugs should not go together, or they will be affecting the activities of each other. So in this section you will find which drugs you should not combine with the one you're currently using, which foods you should not take, or which drinks you should not take, because all of these things have effects on how our medicines behave when we take them. Another section of the patient information leaflet is titled Overdose. In this section, you would learn what you can do in case you or someone else accidentally overdoses on the medication. You will find symptoms of overdose and what emergency actions you should take. In some cases, it may be required that the person is rushed to the hospital, while in some cases, some management may be done at home to overcome the effects. But in every case, please report to the hospital or the pharmacy. Let someone know about it. Also, ensure that medicines are kept away from children so that they don't take these medicines that are not even intended for their use. In this video, you've been able to learn how you can safely use your medications by knowing more about your medicines through the patient information leaflet. And we've been able to touch the various sections of the patient information leaflet, such as the name of the medicine, the side effects, the mode of action, the pharmacokinetics or how the drug is metabolized, the drug interactions, the dosage, overdosage, and how to store your medicines. So, after reading the patient information leaflet, what do you do? From my interaction with patients over the years, I have come to see that some patients would read and understand the patient information leaflet. Some will start reading, get frightened, and stop even their medications altogether. Some would read and seek further information from other sources like the internet, or they ask questions from their doctor or their pharmacist. Whichever group you belong to, it's important for you never to alter your drugs or your prescriptions just because of what you have read off the leaflet. So the leaflet is a very good information guide, and it is tailored for your use. In fact, it is made just for you. So never forget that, and always make good use of it. It helps you to know your medicines better and to get the best out of your medical treatment, because that is the goal of treatment. So till I see you in my next video, don't forget to subscribe and turn on your notifications so you don't miss any of my videos. Stay healthy, stay informed. Bye.